In this revealing video, you will learn the truth behind car accident claims. Dr. Todd Pickman exposes the tactics insurance adjusters use to minimize your compensation and how to protect your rights. Get ready to arm yourself with the essential knowledge to navigate your injury recovery and the legal process effectively. Here is Dr. Todd Pickman of Meridian, Idaho, a car accident chiropractor, explaining it all.
So what's the dirty little secret that the insurance adjusters, attorneys, and healthcare providers are doing behind the scenes? Let's break it down. You're familiar with our justice system, innocent until proven guilty, right? Well, in the car accident world, unfortunately, the insurance adjusters are taught to view you as somebody trying to cheat the system, lying and exaggerating about your injuries, unless you can prove beyond a shadow of a doubt that you have a significant problem. Their flawed formula attempts to base your potential injuries on the amount of damage done to your vehicle, meaning, if your car sustained little damage, how could you possibly have any sort of real injury, right? Wrong. This is simply not how it works. There are cases where the driver is subjected to extreme traumatic forces during a crash and the vehicle damage is minimal, so don't buy into this deceptive line of reasoning. Now, it's not always like this, but more times than not, this is the way that most injured parties feel when dealing with the insurance companies. They often start off nice and helpful, and then they pull the old good cop, bad cop approach. They are incentivized to close your case as quickly as possible for as little payout as possible. Obviously, they have a motivation to do this. They are a for-profit business. There's nothing wrong with them wanting to be profitable, but there is something wrong with you being guilted into and manipulated into closing your case prematurely and not getting access to the benefits and care that you're rightfully entitled to so you can fully recover and avoid lifelong problems. Now on to the attorneys. With all professions, there are good and bad. Over the years, I've personally seen a trend amongst many attorneys out there. Let me start with what to avoid when working with an attorney that could negatively affect you and your family. You want to avoid the attorney that doesn't make every effort to connect with your healthcare providers directly so that they can fully understand the extent of your injuries. After all, they have to intelligently represent what's going on with you to the insurance company to make sure that you are treated fairly. They have to have a solid grasp on various healthcare-related processes and findings to really do the best job for you. So how can they properly represent your best interests if they don't even understand what a spinal ligament injury is, if they're not familiar with excessive motion, AMA guidelines? The scary thing is that by this point in simply watching these videos, you likely have a better grasp on these topics than most personal injury attorneys. Then you have attorneys that just look to settle cases for the bare minimum, and their business model is to make up for these lower settlements by seeing higher volume. They may work closely with substandard doctors that agree to only treat you up to a certain dollar amount and then send you on your way once the bill hits this set magic number. If you're injured and need more in-depth care and more consideration for future compensation, you want an attorney that's willing to go the distance and fight for you. We have a small group of attorneys that we've worked with over the years that thoroughly understand all of the topics that we covered previously, so not only are they well versed on representing you to the fullest legal extent, they've taken the time to learn about the intricate details of spinal ligament injuries and what it really takes to fully recover. The third practitioner to discuss is the doctor. Here's the common scenario that you go through when involved in a car crash. If you get injured and you're in a considerable amount of pain, you go to the emergency room. Their priority is to rule out life-threatening findings, so they may throw you in a cervical collar brace, take a bunch of x-rays and special images, and if they don't see a fracture or internal bleeding, you are sent on your way with painkillers and muscle relaxers with no real follow-up plan set in place. Maybe at most you'd be told to follow up with your primary care doctor if you still have pain in a few weeks. This is a failure in the healthcare arena. Another scenario is if you have minimal to no pain. You may check in with your primary doctor, they may ask you some questions, do a superficial exam, and not bother to rule out any further hidden injuries that you or your other occupants of the vehicle may have. Most commonly neglected are children that are riding in the car, that are subjected to the same traumatic forces that you were, but they don't complain of pain, so the assumption is that everything must be fine. This is flawed thinking as well. Understanding the typical route that an injury victim falls into following a crash is the best way for you to avoid making these common mistakes. So you get in a crash, you have some pain, you go to the doctor. Like I mentioned, they may take some x-rays, and usually not the right ones, and then they prescribe some muscle relaxers and painkillers and send you on your way. The truth is, most doctors don't like dealing with car crash patients as these require more in-depth documentation, thus requiring additional work. Oftentimes, if these doctors do more than simply prescribe pain-masking medications, they will send you off to a physical therapist that, again, will not dig deeper to rule out any hidden spinal ligament injuries. They aren't trained to do so. It's not their expertise. Last tip, and then we'll wrap it up. In the scenario where you injure your neck or lower back and you go see a doctor and they do take some x-rays or special images like a CT scan or an MRI, the majority of the time they do these in the neutral position. Meaning, because of your pain and reactive muscle spasms following the trauma, they don't perform stress radiography like we covered in the earlier video. Even if you're in too much pain to move at that time, the standard of care dictates that within a week or two, following some initial specific care aimed to reduce the pain and muscle spasms, the stress radiography needs to be performed to assess the integrity of the ligaments. This is crucial in reaching an appropriate diagnosis so you can receive the care you need to minimize the risk of lifelong problems following this trauma. In conclusion, we hope you found this information more than just helpful, but empowering, so that you can avoid the common mistakes that people make following a car crash and, most importantly, take the correct actions to protect you and your loved ones. Click the button below to get a hold of our office to schedule a complimentary consultation with one of our doctors, and feel free to call us as well so we can address any questions or concerns that you may have. Thank you for investing the time in learning about how things really work behind the scenes when you're involved in a car crash, and we look forward to meeting you soon.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.